Hello, welcome to Affiliation Basics. This was recorded June of 2026. This recording is a collaboration with KDAT, or Kansas Department for Aging and Disability Services, and PCG, or Public Consulting Group. Today, the goals for this presentation are to give examples of the affiliation process, including key steps, roles and expectations, sharing practical strategies and best practices from experienced providers to support successful affiliation, equipping participants to navigate common challenges and reduce delays in the affiliation process, as well as clarifying next steps to support timely and complete submissions. First, we're going to start with key terms. Importantly, first I want to start and explain the system hierarchy as it relates to affiliation. Think of it like a chain of direction and responsibility from the top to the bottom. At the very top is CMS, or the federal government. CMS sets the big picture rules and policies for how affiliation and Medicaid programs are supposed to work. Next is KDHE, or the State Health Department in Kansas. KDHE takes those federal rules and applies them at the state level. They help oversee how things are implemented in Kansas. From there, the system splits into two paths. On the left side, you'll see managed care organizations, or MCOs. MCOs are the health plans. They manage services, coordinate care, and handle payments for members. On the right side, you'll see KDADs, which feeds into the CDDOs. KDADs, or the Kansas Department for Aging and Disability Services, focuses on programs for people with disabilities and older adults. Then underneath them, you'll see the CDDOs, or Community Developmental Disability Organizations, who operate at the local level, and they help coordinate services for individuals with developmental disabilities. And at the bottom are the service providers. These are the organizations that actually deliver services to consumers, such as community service providers, or CSPs, waiver providers, and targeted case management agencies. In simple terms, the federal government sets the rules, the state interprets and oversees the rules, while different branches manage and coordinate, and then the local providers deliver the actual services to the individuals. Let's start by talking a little bit more about all of these roles. So the Center for Medicare and Medicaid, or CMS, is the federal agency that provides guidance and oversight for states' Medicaid programs. For example, CMS approves and monitors Kansas's Medicaid state plan and HCBS waivers for compliance with federal regulations. The Medicaid state plan is an agreement between a state and the federal government describing how the state administers its Medicaid and CHIP programs. The state plan sets out who will be covered, what services will be provided, and what providers will be reimbursed. Services included in the state plan must be offered statewide and be available to all eligible Medicaid enrollees. Home and community-based waivers. An HCBS waiver is a Medicaid plan authorized under federal law that allows states to provide long-term services in home and community-based settings, such as, say, personal care, day supports, and supportive employment. And these are offered to individuals who would otherwise require institutional care. HCBS waivers allow states to target services to specific populations, to limit the number of people receiving services, or limit availability to parts of the state. The IDD waiver and the community support waiver are two HCBS waivers in Kansas. The Kansas Department of Health and Environment, or KDHD, this is the state designated entity legally responsible for administering and supervising the Medicaid program according to federal and state law. KDHE works to protect and improve the health and environment of all Kansans. The Kansas Department for Aging and Disability Services, or KDADS. This is the state agency responsible for overseeing programs, providers, and services that support individuals with disabilities and older adults across Kansas. Now let's talk about what a Community Developmental Disability Organization, or CDDO, is. The official definition is this is any community facility for people with intellectual disabilities that is organized pursuant to KSA 19-4001 through 4015 and amendments thereunto. In plain language, CDDO is the local agency that helps individuals find and access developmental disability services. They determine eligibility for services. They connect people with service providers, and they ensure that services are coordinated within the community. A managed care organization, or MCO. These are health plans that contract with providers to deliver services to Medicaid members. Now let's talk about what a targeted case management or TCM agency. A TCM agency is an organization or individual enrolled with KDADS and approved to deliver TCM. KDADS requires TCM agencies to have licenses. TCM agencies develop person-centered service plans, or PCSPs, on the Community Supports Waiver, or the CSW. Note, TCM is a state plan benefit and not a waiver service. This matters later when we talk about some of their affiliation steps. Now let's talk about what a community support provider is and a waiver service provider. So these are two types of providers of waiver services in Kansas. Both are organizations enrolled with KDADS and approved to deliver home and community-based services, or HCBS. The difference is a community support provider, or CSP, has a KDADS license, which is required to provide certain services. And a waiver service provider does not have a KDADS license, and so cannot provide services that require a license. Note, from here on, we'll be used the word provider to refer to TCM, CSP, and waiver services providers. Now let's talk about affiliation and affiliate agreement. Affiliation is the formal process to execute an affiliate agreement that providers must comply with to deliver services. And an affiliate agreement is a contractual relationship between a CDDO and a provider. This allows providers to provide authorized services within the CDDO service area, and it also subjects providers to KDADS regulations, CDDO policies, and any monitoring, quality assurance, and any other enforcement. All right, what are key roles for a provider? So KDHC's role is they administer Medicaid funds to the MCOs who reimburse providers. This makes financial eligibility determinants for individuals receiving waiver services. So again, this is KDHC's role that as it relates to providers. And they also issue the provider number after ensuring the provider is qualified through the provider's Kansas Medical Assistance Program, or KMAP portal. All right, what's KDAD's role as it relates to providers? They set the policy and requirements to ensure that CDDOs and providers comply with state and federal requirements. They provide program oversight, and they enforce compliance and maintain authority to review, enforce, and then terminate affiliate agreements as needed. All right, the MCOs, or the managed care organization's rules as it relates to providers. They're the ones who authorize services that are in the individual's PCSP. They contract with providers to reimburse them for authorized services. And of note, as of 2026, there are 3 MCOs in Kansas: Healthy Blue Kansas, Sunflower Health Plan, and United Healthcare. Let's talk about the CDDO's role as it relates to providers. They serve as the gateway for individuals to receive services through affiliated providers. They establish and maintain affiliate agreements with providers, and they provide options counseling to individuals to determine their provider, and they monitor provider performance and adhere to state and CDDO requirements. Prior to delivering services, providers must, 1, meet all state requirements, such as, say, licensing and program compliance if this is a requirement for your provider type. They must affiliate with a CDDO or CDDOs if they want to serve multiple catchment areas. They must credential with KMAP, and they must contract with an MCO or MCOs if they want to provide services to all individuals regardless of what MCO that they're working with. All right, affiliation process, what to do next. The first thing to do is to contact the CDDO or CDDOs you want to affiliate. So first start by using the CDDO service area map pictured to the right from KDAD's website to locate the CDDO or CDDOs you want to affiliate with. So the easiest way to navigate there is to Google KDAD's website and then Google CDDO service area map. Then review the CDDO's process, requirements, and timeline, either by going online or by contacting the CDDO directly. And then notify the CDDO or the CDDOs of your interest in affiliating, and then follow the CDDO specific processes for your next steps. We'll talk about a little bit more about what this typically looks like in our next slide. Most CDDOs will publish a process map that tells you their key steps and where to start in the process. We included an example here, but note that all CDDOs might be a little different. So what you'll commonly see in these process maps is you'll see a green circle at the top that says start, and then you'll see arrows that navigate you to squares, or rectangles rather, that talks about the steps in the process. Anytime you see a rectangle, it's a required step in the process. And anytime you see a diamond, it's a decision point in the process. So for example, if we look at just the top row here, we can see for this CDDO that the provider starts by reaching out to the CDDO, whether that might be a phone call, an email, whether they have maybe inquire here on their website, or it's sometimes even licensure. We'll do this email for you, confirm with licensure that they're doing this. To indicate interest in affiliating. So that would be your first step. We'd recommend that you call them or email them directly. Next, in this CDDO, they refer you to their website where they have things like their process map. They also have a list of all the required documents, and then they also have a list of anything about requirements on their timeline. So all of these pieces would be posted on their website. So if you as a provider would then follow their step and go to their website. And then next, you'll see a diamond in the process map. For this CDDO, and you'll see this one throughout, then it will ask, does this provider type need a KDAD's license? If you're not sure if your provider type needs a license, reach out to your CDDO and they'll help you navigate under what waiver you want to work under, or waivers you want to work under, and two, does that need a license or not? In this, if you do need a license, then your next step in the process is you need to apply for and receive a KDAD's license. If you're one of the provider types that doesn't require a license, you immediately drop down to the next step, which in this case is the CDDO then will schedule an in-person CDDO affiliate introduction meeting with the provider to review the CDDO specific affiliation agreement, their guidelines, and all expectations. For this particular CDDO, they have you sign the affiliate agreement at this stage. Of note, other CDDOs will have you sign at later steps. So again, you need to work with each CDDO to determine when that signature happens. Another note is, as we keep working our way through this process map, in this particular CDDO, they then countersign, meaning that somebody that has signing authority at the CDDO, they then sign it to be able to validate this agreement. Again, for this particular CDDO, this happens early in the process. You'll note with some other CDDOs, this might happen much later. That's okay. They're allowed to have that discretion. Next, the CDDO will send a copy of the fully executed affiliate agreement to the provider. Again, this may change by CDDO. And then at this next step, they will have the provider apply via the KMAP website for the KMAP provider number. Of note, when you log into that KMAP site, there might be many steps that you need to do based on provider type. I won't go through all of them now, but note that there are some steps, and it's worth it for you to go to the KMAP website to just look at all of these steps. Next, in this particular CDDO, after the KMAP issues the provider number to you as a provider, they then would have you contract with an MCO or all three MCOs that you want to work with. Again, the consumers decide what MCO they want to work with, and then these MCOs in turn will pay the provider. You can choose to work with just one, with two, or all three. Then after the provider gets the MCO contract, this CDDO asks that the provider then notifies the CDDO of their MCO contract or contracts. And then at that point, the CDDO will add you as a provider to their open list and to their CDDO website and to their choice form. So that means consumers or individuals receiving services can then choose you as a provider to be their service provider for the services that you're eligible for. And then at the very end, it says the provider is now eligible to start providing services to the individual. And then we make a note that that's the end of this process map because we're looking purely at from the moment that the CDDO learns that the provider wants to affiliate with a CDDO all the way until that provider is added to that CDDO's choice form and consumers can start choosing them to be their service provider. And then again, when the provider is eligible to start providing services to the individual. So again, these last two slides are just an example, but I did want to take the time to explain what we've seen as a typical process, just to kind of give you a little bit more insight about what's happening on the ground. All right, next, we also want to address a common question that we've heard as part of our business process review with working with KDADs. A common question that we've gotten is, do I need a new agreement to add a new waiver? Say I'm currently a PERS provider, and the question is, if I'm currently a PERS provider for the IDD waiver, do I need to do something different to be able to provide services under the CSW? The answer is that CSPs and waiver providers do not need a new KDADS license, but they must complete the following steps. They must affiliate with or amend their existing affiliate agreement to add the new waiver through the CDDO. They must update their KMAP credentialing to add the new waiver. And they must update their MCO contract to include the new waiver. Of note, targeted case management, since this is not a waiver service, they do not need to take any additional steps to provide TCM on a new waiver.
Next, we're going to review provider affiliation best practices. These best practices were compiled based on feedback from providers and CDDOs who have gone through and are familiar with the affiliation process. The first best practice is to get organized. Affiliation and its various sub-processes can require quite a bit of documentation and has various due dates and deadlines. We'd recommend tracking these key dates throughout the affiliation process. And we'd also recommend tracking key dates once the affiliation process is complete, such as your licensure renewal date and your CDDO affiliate agreement renewal dates. Next, it's recommended that you keep a centralized folder, either digital or physical, where you can store any required documentation that you need to submit or that has been submitted, timelines for affiliation, key contacts, and a log of what materials you've already submitted. Not only will this be able to help you track your progress throughout the affiliation process, but it will also help you to be able to respond more efficiently to information requests. Finally, be sure to plan ahead for renewals. Save copies of all of the documentation that you've submitted and keep notes throughout the affiliation process. Make sure to keep a log of key renewal dates and required renewal activities. Add those to your calendar early so that you're able to avoid last-minute issues and better prepare. Next, many providers reported that when they leveraged resources that are specifically there to support small businesses, they found it incredibly helpful. If you're a new or small business, consider using resources such as the Kansas Small Business Development Center, which can be located at kansassbdc.net, the Kansas SCORE Mentors at score.org/KS, the Kansas Chamber of Commerce, which can be found at kansaschamber.org, or your other local chambers of commerce. These various resources are geared toward small businesses and can offer guidance on compliance, operations, long-term sustainability, and may be able to assist in the development of various business documents. Numerous providers told us that one of their most valuable resources was the information that they got by speaking with other providers who had already been through this process. We'd recommend that you also consider reaching out to other providers that offer similar services to yours and explore opportunities for informal mentoring and peer support. This could look like other providers sharing their lessons learned from when they went through the affiliation process. It could also look like other providers offering guidance when you're developing your policies and procedures. Being able to speak to and ask questions of other providers who have already been through affiliation can be incredibly helpful when you're beginning the process yourself. Next, we'd recommend that you build relationships early on with your CDDO. Be sure that you understand who to go to with questions and what the expectations are for communication. It's really important that you ask clarifying questions up front and confirm those expectations early on in the process, as this can really help to avoid delays and confusion later on during the affiliation process. Affiliation in its various processes can take some time. It's important that you know this going into the affiliation process so that you're able to build in extra time for the reviews, approvals, and follow-up requests at the various points in the process so that the steps to affiliation don't delay your ability to begin service delivery. The affiliation process does have some costs associated with various steps. It's important to plan for these upfront costs while you're beginning the affiliation process. Steps that have associated costs include but are not limited to things like background checks, training like CPR and first aid, KMAP enrollment for some service types, and other various administrative requirements. Building these expenses into your early planning can help avoid delays and surprises of costs along the way. Next, and this applies not just during the initial affiliation process, but also during your entire time as an affiliated provider. Engaging in community-based marketing can be incredibly helpful. Providers and CDDOs both told us that by participating in community events, like Special Olympics, resource fairs, or other similar activities, you're able to promote services, build local relationships, and stay current on industry best practices, and create relationships with other providers as well. While you're going through the affiliation process, as well as once you're an affiliated provider, it's very important to understand how changes to your business impact the process of affiliation, as well as the process of being an ongoing provider. Business changes, such as changes to your name or business ownership, may require that you update your license, KMAP enrollment, affiliate agreements, and MCO contracts. Be sure to notify all required entities promptly of any significant business changes, both while you're going through the affiliation process and once you are an affiliated provider. If you have a license type that requires a KDADS license, it's recommended that you consider adding a second person to your KDADS license. This is because licenses are non-transferable. If you have one person listed on your license and not a board, and they leave, then your license is now invalid. It cannot be transferred to a new person. Your license is separate from your business. However, if you add a second person on your license or application, they can then hold that license while the first person is replaced should they leave. During affiliation, there may be additional processes that are required. It's important that you familiarize yourself with these required state guidelines. Some provider types must complete a KDADS licensing process at the beginning of affiliation. Certain license types require providers to submit policies and procedures, either during this licensing process and/or during final settings review. If you have questions about what is required in these policies and procedures, you should review the state statutes, which include the Developmental Disabilities Reform Act and other published guidelines. It's important to be prepared to revise materials based on KDADS, MCO, and CDDO feedback and build this into your timeline for affiliation. The following slides feature instructions for accessing licensing, certification, and the HCBS settings final rule guidelines. In order to access information about licensing and certification, navigate to the KDADS main page. From the main page, click on the top banner for licensing and certification, and then on the left-hand banner, click Intellectual Developmental Disabilities Licensing. You can see these two areas highlighted in yellow below. This page has a number of resources and information regarding licensing and certification for different provider types. For information about HCBS settings final rule, begin again at the KDADS main webpage, then click on the top banner for services and programs, and then on the left-hand banner, click Settings Final Rule. You can see these in yellow in the graphic below. This page has information and other resources regarding HCBS settings final rule. Finally, we'd like to share some resources which may be helpful for you while going through the affiliation process. The first resource is the KDADS Provider Escalation Guide. You can locate this guide by utilizing the search bar on the main page of the KDADS website and by searching for Provider Escalation Guide. This guide has a list of contact information for various entities and types of issues that you may encounter throughout the affiliation process. Next, the KMAP Provider Training webpage. You can locate this webpage by going to the KMAP website and then by selecting Provider from the top banner and then Helpful Information. This site includes trainings on provider registration, billing, and more. These next 3 slides contain information regarding the KMAP Online Provider Enrollment System. To access the Provider Enrollment System, you will navigate to KMAP's website and then select Provider Enrollment from the photo tiles on the main page. This page then directs you to the online system to enroll as a Medicaid provider. Here you can also find the enrollment wizard, training videos, and other enrollment resources. When you click on Provider Enrollment from the KMAP main webpage, it will bring you here. From this page, you can either start a new enrollment application or resume an application that is already in progress. This page also has information regarding the statuses of applications, links to outside resources, as well as a link to frequently asked questions. If you scroll to the bottom of that page, you will see the box titled Enrollment Pre-Checklist. By filling out the various drop-down menus in this box, you'll be able to generate a checklist that lists the various credentials and documents that are required for you when completing your enrollment application. This box can be incredibly useful as you'll be able to generate that checklist before starting your application, which will make it easier to gather all required documentation before you go into the system to complete your application. If you have any questions regarding today's training, you'll find the contact information for KDADS on the next slide. Please reach out to kdads.csw@ks.gov should you have any questions regarding this training on the affiliation process. Thank you so much for participating in this Affiliation 101 training. We hope you find it helpful as you navigate the affiliation process.